I'm super excited to be here with one of my favorite people and closest friends, Dr. Christine Schaffner. Dr. Christine has seen, usually patients who come to see her have seen 20 to 30 practitioners before they find her. And one of the things that other people miss that Christine knows to look for is any kind of inflammation or congestion in the vagus nerve. And so I'm going to have Christine jump in and kind of talk about what are some of the a typical patient look like that might have some vagus nerve toxicity or inflammation?
Mm-hmm. Well, thank you, Jody. I'm so excited. We've had so many of these conversations over the years trying to understand, what is really going on with the vagus nerve, because that's a place where we both love to dive in and connect with. And when I'm thinking about how to share information today, really dozens of young women and women come to mind who I treat. And it's this constellation of symptoms that these women are struggling with. And we're learning every year on how to help them better. But the typical patient that I would see that has really a dysfunctional vagus nerve, and we can go into that, what that means, but a vagus nerve that is infected and inflamed and can be filled with environmental toxicants, and there's just not this brain to body connection or body to brain connection that we want via this amazing cranial nerve that we have wandering through our body. And so the patient that I think about when we're talking about this is maybe a woman, and again, men have these symptoms too, but I think women, for lots of different reasons, are a little bit more skewed to having this constellation of symptoms. So they might have something called POTS, or it's called postural orthostatic tachycardia syndrome. So when they stand up, their heart rate goes very fast, and they feel dizzy and unwell, and it's quite debilitating. They might have some form of mast cell activation syndrome. So that term gets thrown around a lot these days, and I think it's a really important area to look, but we're not always seeing the extreme version of mast cell activation syndrome, but this imbalance of mast cell and histamine response in the body. We also see these patients have, they might be mold sensitive. They also, might have Lyme and co-infections, especially a Bartonella infection that we know that can wreak havoc on the vagus nerve. They can also have different mental emotional symptoms from obsessive compulsive disorder to anxiety, insomnia, depression. There's also this whole gut paralysis or gut dysfunction where they have slowed motility in their gut that's related also to slowed bile flow and constipation. There's also, again, these are, I would say, what the symptoms are that they look like for this patient, but there's areas of what we would call focal infection in the body that we can talk more through, and these are maybe these hidden or stealth infections that are also preventing the body from getting well and recovering the vagus nerve. So I'm happy to share more, but as we look at this kind of constellation of symptoms, these women are highly sensitive. They're highly symptomatic. Their lives are very halted because of what they're going through. And so it's been quite a journey that many of my patients have gone through, and they teach me every day. And I think we've learned, I've only been doing this 10 years, but in the 10 years, I think we've learned a lot about, what to look for and how to help these women and how to get them on the road to recovery more quickly.
And I love, thank you for putting all those constellation of symptoms together, because I think you're going to connect a lot of dots for people about why these symptoms that may not seem to connect are connected. So I'd love to talk about, I know that you've done a lot of research about the neck channel and the vagus nerve, and how when the vagus nerve is congested or infected, it kind of impacts the ability of the body to function. The brain to signal the body to signal the brain. Can you land on that a little bit and just explain what you're seeing and why that is triggered?
Absolutely. And so when we think of just anatomy, so the vagus nerve is the 10th cranial nerve. It exits the brainstem, and there are branches alongside the neck. So, Jody and I did a class a few years ago, and we talked about how the neck is really this highway, in the body, in and out of the brain, in an area where I see, because of the work that we do, that I see a lot of, things to clean up in this area to help restore function of the vagus nerve. So when we're thinking about this, Diana Driscoll actually did some wonderful work. I interviewed her on my podcast. She's done a lot around, she sees this syndrome as well, and she had no personal experience, but she talks about improper cranial pressure in a lot of these patients. So what that means is there is pressure or fluid buildup in the brain. And I look at it more of from the angle of the lymphatic system. So I'm thinking when patients have improper lymph drainage in and out of the brain, that this can create a pressure gradient, and we can go through all of this. But what can happen is, let's take a step back and say the underlying cause for some of these women or these patients, they might have a chronic viral infection, they might have Lyme and Bartonella, so they may have congestion in their cervical lymph nodes. So their cervical lymph nodes may be an area that, if you feel their neck and you can palpate these lymph nodes, so signaling that the immune system is highly active in this area. And so what we see with this is twofold. One is, just think of it as like there's a kink in the hose. So if there is pressure or inflammation here, that's going to create a backup or buildup of lymphatic fluid in the brain that it won't be able to properly drain. And so when that is happening, there's this pressure gradient that also affects the venous system. And not to get too in the weeds with this, but the lymph system is highly connected to the venous drainage, or many people have heard of the jugular veins, right? So these are the veins that are the exit route of blood out of the brain. And so the lymph flows along the veins. So again, taking another step back, we see with some of these patients, when you have Lyme and co-infections, these things can affect the endothelium, or the lining of the veins. So
Exactly.
then that can create just changes in the structure of those veins that creates pressure or buildup. And so what I'm painting the picture of, if you're stuck here, this won't drain, and there's going to be pressure here, right?
Right, and it's the lymph, the veins, and the vagus nerve that are all kind of competing for space. And if one takes up too much space, the other has less space.
Yeah, exactly. And, we see that specifically in something called the carotid sheath, which Dr. Driscoll writes about in her book, where there's an area in the neck, it's called the carotid sheath, where the carotid artery goes up to the brain, the jugular vein is in that, as well as the vagus nerve. So when you have this pressure buildup in the system, the vagus nerve is going to become compressed. And that's going to essentially affect the communication. So there's a structural piece to this. And then when we have infection, inflaming our cervical lymph nodes, the proximity to those pathogens to the vagus nerve can basically, through the work of Van Alsacker, I can never say his name, but
the Tufts researcher, Michael Van Alsacker.
Yeah, so I think he paints the picture. It's funny, and you know this about me. We see patients every day, and I feel like a detective and an observer. And then I, go into, PubMed and Google Scholar, and then I'm like, oh wow, this is all related. And so it's really wonderful how he really, created more of a scientific, medical understanding of what we're seeing with the infection piece of the vagus nerve. And so if you have these pathogens in the cervical lymph nodes, the proximity to the vagus nerve, so part of our nervous system, we have not only the nerve, but there are these cells that protect the nerve called the glial cells. And the glial cells can become highly alerted that there are viruses or Lyme and co-infections. And then that sets a whole cascade of signals to say, hey, wait a second, brain, we are under attack and we need to kind of slow things down so we can get on top of this. And so what's happening is these infections are basically creating this inflammatory process in the body that goes systemic via this really connection really in the neck. And it's the proximity of these pathogens to these glial cells that are signaling to the vagus nerve, that are signaling to the brain, and that's why the systemic issues are happening. And so, that's a big piece to land on, and we can.
Right. Now I want to back up a little bit because you've shared so much great information. So vagus nerve infection hypothesis, which is about pathogens and infections kind of triggering that sickness behavior. And that's what we sometimes see in chronic fatigue syndrome, fibromyalgia, or multi-chemical sensitivity. And also just the structural piece where the neck holds, you know, the lymph, the veins, the vagus nerve, obviously the bones, and compression on any one of those can impact the signaling and the ability. And you mentioned, I'd love to get into first kind of the root causes. You mentioned infection as one of them. And then I'd love to talk about some of the strategies. Obviously, every patient is different, but things that you see working to kind of improve that communication. If you can land a little bit more, if you want to expand on infection or gut or any of the other histamine issues that are at play.
Absolutely. So I think before we move from the head and the neck, so when I talk about infection, right, so we know in the world that I work, we look at the immune system, we look at environmental toxicity, and of course that intersection. But when we're thinking about infection, we're thinking about, you know, of course, viruses, retroviral infections. We think about Lyme and co-infections. We think about mold illness, so environmental mold exposure, and then also fungal infections, and of course, parasitic infections. So we're looking at that whole soup, and why this is a very hard problem for conventional medicine to solve is because it's not one thing, and this is not a linear process. This is a ecosystem that gets imbalanced when the body is under stress. So when I talk about any of these things, most of my patients have a combination, and you know, it's the chicken or the egg, right? So as far as, you know, so we're always going to evaluate, assess, and do the labs that we can to demonstrate these things. But one of the reasons why some people may have gone through treatment for any of these infections but still are not getting well is because they have something what we call a focal infection. And so a focal infection, this is a term that we use that comes out of German biological medicine and neurotherapy, that these are these hidden infections, and why they're hidden is the immune system isn't having its appropriate response of saying, hey, let's go clean this up, right? Of course, I'm, you know, simplifying that. So the infections that we find that are very related to the health of the vagus nerve are when we look at the tonsils, we look at the mouth, and we look at the sinuses. So just to go through all of those, so the tonsils are a huge area of lymphatic tissue that are really important for our brain and our gut health. I really feel like that's really where the immune system connects our gut and the brain, and in the tonsils. And we have this ring of lymphatic tissue called Waldeyer's ring. So we always think of the palatine tonsils, which are the tonsils we know that get swollen when we have infection. And then we have the adenoids, the tubal tonsils at the end of the eustachian tube, and then the lingual tonsils underneath the tongue. So that whole ring of lymphatic tissue, if you've had chronic strep, if you've had mono, if you've had any kind of chronic infection, this can be an area or a reservoir of infection that's an entry point to creating inflammatory, basically not only pathogens, but inflammatory cells to keep them, but basically the microglial activated and keep brain inflammation up. So we want to always address the tonsils, and many of these patients that I work with that I've shared, they either have had chronic tonsillitis, a history of strep, history of Epstein-Barr. In some patients, I do recommend a tonsillectomy. I never take that lightly, but when you see these patients struggling for so long, sometimes that's going to be, you know, the pros and are going to far outweigh the cons, and we just need to get that really unhealthy tissue out of the body, so the body.
And is that because I've heard Klinghardt said the tonsils are the toilet of the brain? Is that because keeping the tonsils in there kind of keeps these pathogens in circulation, and removing them eliminates it?
Yeah, exactly. So when we think about that toilet of the brain comment, the lymph out of the brain drains in the cribriform plate. So if you Google that, that's kind of at the base of the sinus, and basically it's the communication between the sinus and the brain, and the lymph drains through there, and then drains in the back of the throat. So if that's a highly infected or congested area, that's going to affect lymph drainage. Just think of that whole, you know, basically congestion.
Beautifully
and in the neck. And so that, so again, and then this is Dr. Vostani, who is the Cyrix Lab, you know, owner or lead advisor there. He wrote a paper showing how strep can, in the tonsils, basically can create this Th17 response, which means that they're keeping the microglia activated because the cells are going through the cribriform plate and getting through the brain to the brain. So it's like the location is key there.
Right.
And so when we remove the palatine tonsils and the adenoids, again, I'm not recommending this for everyone. And again, I know this
Right,
sounds—
but it could be a blind spot. Like if people have been sick for a long time and they don't know to look here, this could be hugely
Yeah,
helpful.
absolutely. And so when you see the patients we see where, tonsillectomy is like no big deal if it's recovering your health and your life, right? And so
Yes.
getting that, sometimes removing that tissue can just allow us to see like leaps and bounds and progress rather than trying all the tools that we know, which, of course, in a perfect world with unlimited resources may work eventually, but it just is a slower process.
Oh, yeah.
So the tonsils are really important. And then the mouth, right? So the mouth is an area, just again, even if you just think very simply that the proximity of the mouth to the neck and the vagus nerve. So if we have
Yes.
any infection or environmental toxin in the mouth, that can affect the vagus nerve. And so we screen all of our patients for amalgam fillings. Most patients have an awareness of that, but still many patients still need support getting their amalgam fillings out. We screen for root canals. Root canals are essentially dead teeth. Basically, a tooth dies, the nerve is taken out, and then a dentist stuffs the root canal with non-biocompatible material that can basically be a breeding ground for infection over time, and they've shown that. And so even when we have these root canals extracted and we send them to labs, we see a host of viruses, bacteria, even amoebas. So we know these are not sterile teeth, and even cardiologists know that our oral health is hugely important to our systemic health because of the blood supply and the entryway to the rest of the body. And then we look at the wisdom teeth, right? So the wisdom teeth in some patients, when they're removed, they're not removed as properly as we'd all like. And then depending on the state of the immune system too, that area where you take the wisdom tooth out becomes a pocket, and it doesn't really fill in with healthy bone. It becomes a pocket of infection, a reservoir of infection where Bartonella can hang out, viruses can hang out, bacteria, even parasitic infections can hang out. So the wisdom tooth area is related to the small intestine, endocrine, and heart, all vagus nerve system. So in Chinese medicine made that connection already for us, but when we think about just the proximity to the vagus nerve, that can be a big roadblock. So we look at the tonsils, we look at the mouth, and then whenever we're looking at the head and the neck and the brain, we always look at the sinuses for all the same reasons we look at the tonsils, right? The proximity to the brain, and if someone's had a mold exposure, or I just kind of, most of my patients have sinus issues, and I just think of it as they have sinus dysbiosis, right? Just like how we have gut dysbiosis, there's a whole microbiome in our sinuses that often gets imbalanced, and we just need to continue to change up strategies. So we just really, whenever we're trying to recover the vagus nerve, we really clean up this area, and then we want to get the lymph draining, right? And so the lymphatic system is this whole other system, and I know you and I both love learning about the lymphatic system, and I feel like the lymphatic system is, still really one of the most overlooked systems in the body. I mean, I always remind people that the lymphatic system was only discovered in 2015. They just study, they just call the interstitium a new organ, which is highly interconnected with the extracellular matrix in the lymphatic system. Even the mesentery in the gut, they found just a few years ago, it's this continuous, connective tissue lining in the body that has a lot to do with communication. And so, I just share that because it's like when you Google lymphatic system, it's not going to, I think we have a lot to learn still. And I think we have a
Well,
lot
and
to
I
do.
want to pause and just sing your praises. That was the best explanation I have ever heard about the tonsils, the teeth, and the sinuses, and why, there are people that walk around and they always have a stuffy nose and they kind of live with it or think it's nothing. And it never occurs to them that until they clean that up, that can be mold, that can be throwing off their whole body. So thank you. That was unbelievable.
Thank you.
And that's kind of a key starting point. And then the lymph, we don't really think about the lymph because you know, it's forgotten. The cells mobilize into the extracellular matrix, then the lymph carries things to the blood, but the lymph doesn't move itself. And so it's really important if you can kind of land on the lymph and land on, even, I know you have done some photographs of congested lymph nodes and how that impacts the vagus nerve. If you can talk about that a little bit, I think it's fascinating.
Yeah, and I think you know, with conventional medicine, their understanding of the lymphatic system is, you know, post mastectomy, lymph nodes removed, people get swelling, and then all of a sudden they need compression to support them. And you know, it's way more than that. And I think our patients, the lymphatic system is where all the action is, right? It's a waste clearance system. You know, it's also an immune surveillance system. So that's where, you know, all of these stealth pathogens are not circulating in the blood. They're in the fascia, they're in the connective tissue, they're in the lymph, they're in the organs, they're in the nerves. And so the lymph is kind of this intersection there. And so, so with the lymphatic system, one of the things before we talk about the neck, I also always want to remind people that in order for the head and the neck and the extremities to drain, we have this whole lymphatic system in our gut. And so one of the things that we learned through friends in Germany, she trained us in a lymphatic technique called Sophia Matrix. And what that means is that we start on the abdomen before we go to the head and the neck and the extremities. So even if you're thin, you can have if you've had a chronically inflamed system or a chronically inflamed digestive tract, you can have a buildup of lymph in your gut. And so what we do is we help to drain that lymph with manual techniques. There's all sorts of wonderful other tools too for the lymph. And I think even mine, abdominal massage, castor oil packs, even you know, colon hydrotherapy and coffee enemas, I think part of why they work is they're getting the lymph to move, you know, in the gut as well as the bile, of course. And so, so just
and to that point, what you've said before is that the body is a hydraulic system, and so if there's congestion down below, the brain can't even drain. And so that's, I love that you do that. I don't think people talk about that. Really getting the gut moving, you know, or even if you're constipated, starting there, you can't start mobilizing toxins from the brain if there's congestion lower down in the system. So keep going.
Yeah, absolutely. And of course, that ties into the vagus nerve, just to take a step there, that, you know, a lot of these women and a lot of these patients have slowed motility in their gut, right? So they're going to be constipated. They're going to have sluggish bile. The vagus nerve actually communicates to the gallbladder to release bile. And so if you have vagus nerve dysfunction, you can have bile stagnation and constipation. And so it's this kind of catch-22, right? But we have lots of tools to help override that while we're healing the vagus nerve. So we're going to use bitters and bile salts and phospholipids and, you know, different things to support acetylcholine communication in the gut, and different, you know, things as simple as magnesium and vitamin C and other herbs to get the bowel moving. So that's really important for sure. We always want to make sure our organs of elimination are properly moving, so we can minimize side effects or reactions when people go through treatment. So yes, we got to get our guts, you know, moving. And I always like to say, you know, we talk about the gut brain all the time, but think about the gut brain in this kind of lymphatic connection. So the lymph in the gut and the lymph in the brain are highly interconnected, kind of this parallel system in the body. Alongside, of course, we need to look at the microbiome, and we need to look at all the other things in the brain. But I'm just trying to give just a different lens of looking at things. And so, so going.
And I want to really land on, you're hitting it from both angles, right? You're helping to kind of get the vagus nerve activated from the brain down, and then you're also working from the gut up, so that it's, you know, it's almost like the information highway. You're helping it meet in the middle by working at it from both ends.
Yeah, and when you know how the vagus nerve works, right? So, you know, 20% is brain to the body, and then 80% of the fibers are body to brain. So it's that bidirectional communication that's so fascinating about this nerve, and we have to look at it from both angles for sure.
Right. And I love that you brought in the gallbladder. You know, coffee enemas are a great way to activate the vagus nerve.
And that's why, right? You know,
Yeah.
so yeah, that's awesome. And so just kind of coming upstream to looking at the lymphatic system in the neck. So we are friends with Dr. Ruggiero. He's a wonderful man, a researcher who's done a lot of viral research and retroviral research, and also developed and formulated products. And he helped us develop something called the Sophia Flow Cream, which is a unique cream that has a probiotic in it that produces something called macrophage activating factor. And it has this unique property to help move lymph and also support the immune system. And he is a radiologist. And so when we were developing the cream, he came to our clinic and did images of our patients and looked at via ultrasound. So he looked at basically congestion, in the neck and basically lymph node swelling and all of these signs of lymphatic stagnation. And while I'm talking, I also want to make sure I reference his paper, which he did with Dr. Bradstreet. And he knew this work before he came to our clinic. And so he saw in the children with autism that they had pooling in their brain of lymph buildup in the brain, and they also had cervical lymph node congestion. And so they demonstrated by opening up the lymph in the neck, they were able to move lymph in the brain, and it led to symptom improvement. And so that really inspired him to come up with more tools. And so we demonstrated.
And to that point, I saw the pictures. What was fascinating to me, we were kind of talking about how, the lymph, the veins, and the vagus nerve, one can congest the other. You kind of had these before and after pictures where you had the congested lymph that was pushing against the vagus nerve. And then anything you apply transdermally gets into the system sometimes faster than what you assimilate through your digestive tract. So it really helped to open up the lymph, and then it left more space for the vagus nerve and improve vagus nerve function.
Absolutely. And so we use the flow cream. You have your lymphatic essential oil blend. There's the self-lymphatic drainage massage. There's different, lights. I love, I have the sauna space thing on my desk here that's near infrared incandescent light that, light really moves blood and moves lymph. And so I think, we probably underutilize light, even though it's becoming more popular and more affordable for people to have home units.
These are all great tools, and you have a great video on your site about how to, if people get nothing out of this video, just knowing to help move lymph in their neck could make a really big impact.
Absolutely, absolutely. So, yeah, and you already kind of summarized, just moving the lymph in the neck is going to offload stress, on the vagus nerve structurally, and then using tools like the flow cream that has the immune support, and then systemic tools, we have to get to the root of the infections, right? We have to support the body clearing the infections, and we use a lot of herbal medicine. We love using liposomal delivery for herbs because of the absorption, but herbs work, and they just did a study through the San Francisco arm that supports Lyme research, and they looked at Borrelia, and it's basically Borrelia. It was an in vitro study, but it was essentially looking at different herbs, their effect against spirochetes versus antibiotics, and all of the herbs that we traditionally use, they used, and they showed that they were way more powerful. So things like cistus and Japanese knotweed and artemisia, and we love, andrographis and astragalus and redroot, and all of these herbs that are really wonderful. So we use different Lyme herbs, we use different antiviral herbs. We also, of course, treat parasitic infections. I think parasitic infections are very commonly overlooked and very, 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 very common. So not only, when we say parasitic infections, we're not only talking about worms, but we're talking about protozoa. So protozoa act more like bacteria, and there's definitely a connection between chronic parasitic infections, and they can affect the lymphatic system. So sometimes I am always reminded that clearing up parasitic infections can have a profound effect on the lymphatic system. So if you're trying all these things and still stuck, please, work with a practitioner who acknowledges not only the labs you can do to try to demonstrate parasitic infections, but also the clinical signs and symptoms. And one of the things that we note is that unfortunately, some of the lab tests, there are a lot of false negatives, meaning that parasites are really, tricky. And when we do a stool sample, we're not always going to capture, an active parasitic infection. But the tests are getting better. I like GI map and I like diagnostics. However, if you do a basic complete blood count, lab test, there's an immune cell called an eosinophil. And eosinophils tend to be related to allergies, but they're also responsible for helping the body clear parasitic infections. And of course, I think of the connection between parasites and allergies, but that's a whole other topic. And so
So what you're saying is if their blood work comes back with those levels high, think parasites.
yeah, if the eosinophils are above 2%, I would say, and you have other signs and symptoms, that can be a clue. So that could just be
Yeah.
a clue.
And I just wanted to say, I love, plants. The reason I love essential oils is because they're helping the immune system of the plant. So it makes sense to me they're fighting predators, that they would be powerful in parasites.
Absolutely. And I know there are, just lots of herbal tools to medications that we use for parasitic infections, but, that's another way to also help, recover the gut. If you have chronic dysbiosis or chronic liver gallbladder stagnation, I've tried a lot of things, parasitic infections can affect the bile ducts and of course lead to dysbiosis. And so it's a very rewarding thing to treat. You just have
Yes.
to be comfortable identifying it and looking there.
And can I ask you to talk a little bit about histamine and the vagus nerve and how those are correlated?
Yeah, there's this whole realm that I continue to dive in about histamine and all the variations, but a lot of these patients that I've mentioned, kind of this constellation of symptoms, they often have, whether it's a diagnosed mast cell activation syndrome, which some of them do, to some spectrum of an overactive mast cell response, meaning that their mast cells are more easily triggered to release histamine. And so histamine creates all these symptoms from hives to rashes to flushing to nausea to there's a lot of brain fog. There's a lot of symptoms you might not always translate to just rashes and hives with histamine. Dr. Jill Carnahan has a really great blog post on histamine. So this histamine response is, it also makes these patients harder to treat because they're highly sensitive too. So they're going to be the people that I start with one drop of an herb or,
Right. So they don't react.
yeah, exactly. So all of this stuff. So I feel that, there's this whole, we're still learning about histamine. And so there are natural compounds to help stabilize the mast cell or help the body clear histamine better, or, our H1 or H2 antagonists, and then there are medications as well. And so how this all relates to the vagus nerve is, I think, manyfold.
Right.
The things that I can kind of share with in my mindset. So there's a lot of histamine right in the gut. So we have our parietal cells in our stomach that produce histamine. So if you have chronic dysbiosis in your gut or mast cell activation in your gut, remember the vagus nerve is going to sense that in the body and communicate that to the brain. So it can be a signaling thing that happens in the digestive tract. The other piece that I still am learning about is the brainstem connection, where there's a lot of mast cells in the brainstem. And so the way that the vagus nerve communicates to the brain is via the brainstem. It has to cross the brainstem to go into the thalamus where it's
Right.
communicating. And so, so again, when the body is in this overactive mast cell response, it can affect the communication in the vagus nerve. And the other thing I see too, Jody, is that when the vagus nerve is really stressed, right, and having a hard time because of all of the things, infection, we haven't even touched on environmental toxins that affect the vagus nerve, but there are all of these, stressors. And then I come to think, and maybe I'm wrong, that mast cell is kind of secondary to all of this, but it's definitely it's a presentation. And so what happens is, what I believe is that this is like this whole other secondary inflammation that's happening in the body, and then that's creating a lot more stress when there's this histamine response that's overwhelming the vagus nerve, and then the vagus nerve was already stressed and doesn't have the proper communication to turn off that inflammatory response from the
Right.
histamine that it knows how to do. So long story
It
short,
becomes a vicious cycle. One
yeah,
feeds the other.
yeah. And long story short, if the vagus nerve is dysfunctional, not producing enough acetylcholine, it's not equipped to balance this histamine response. And so this histamine response is going to be overactive because what they've shown is the vagus nerve stimulation can actually help quiet mast cells. So it's part of the putting the brakes on the histamine, if you will.
That is so amazingly put. You've shared so much amazing information. I'm so grateful. Did you want to kind of touch on the gut, or did you want to just
You know,
share your?
yeah, I think just with gut health, you know, think of lymphatic drainage in the gut, think of, you know, of course, all the things that create dysbiosis from bacteria to fungus, and don't forget parasitic infections. I think health is all about lymphatic flow and bile flow. I'm a big proponent of getting the bile to move in any way, shape, or form that you can. Coffee enemas being a really wonderful strategy, especially when you're not feeling well. So I think those are the things that I really want to make sure people take away with, is, you know, if only you can do at home castor oil packs and coffee enemas, you're doing a great job supporting your lymphatic system and getting the bile to flow in your gut, which will translate into, you know, better balance in the gut that translates to better, you know, the vagus nerve can tell the brain it's all okay down there. So, so yeah, that's what I would just leave with as far as digestive health.
This was so amazing. Thank you so much for doing such a deep and such a incredibly comprehensive and understandable dive about the tonsils, the mouth, the neck, the, you know, lymph, the gallbladder. This was amazing, Christine. Thank you.
Well, thank you for the invitation, and I'm so excited that you're sharing all the information that you are.